I am going to hit record now. All right. So I am Shantae Davis Patterson, and I am the Program Director for California's Comprehensive Cancer Control Program. And our program administers the California Dialogue on Cancer, or CDOC. Just want to do some quick housekeeping. All participants have been muted, so if you want to ask a question, go ahead and unmute yourself. You can also ask questions in the chat. We will be monitoring the chat. And as I said, the webinar is being recorded. And at the end of the webinar, we will have an evaluation. Please help us make these webinars better by filling out that evaluation for us. So this webinar today will present a synopsis of the treatment and survivorship objectives and strategies in the new 2021-2025 cancer plan. We'll also hear about Zero Breast Cancer's work in collaborating with researchers and communities to increase knowledge of the burden of cancer survivorship and issues faced by cancer survivors, as well as their work in identifying and addressing the needs of cancer survivors as they align with the cancer plan. And then lastly, we'll hear about the efforts of the CDOC Survivorship Workgroup. Just kind of wanted to give a quick overview on the different topic areas that are included in the cancer plan. And as you see today, we'll be reviewing the treatment and survivorship chapter. Our speakers today, I'm very, very delighted that we do have one of our leads in developing the 2021-2025 treatment and survivorship goals and strategies, Allison Clayton. She is the program manager for the Stanford Cancer Survivorship Program. And she was also, as I said, on the CDOC Survivorship Cancer Plan Subcommittee. We also have Catherine Thompson with us. She is the program director at Zero Breast Cancer, and she is also our very new chair of our CDOC Survivorship Workgroup. Now, before I turn it over to Allison, I want to ask people to mute their lines. I thought everyone was automatically muted, but I do hear some noise. Please mute your lines if they aren't, and if not, I'm going to go ahead and mute everyone. But you will be able to take yourself off of mute to ask questions. And without further ado, I'm going to turn it over to Allison Clayton.
Great. Thank you very much, Shantae. And I'm very happy to be here today to talk about the cancer plan, the Chapter 9, Treatment and Survivorship. So I'm going to cover the objectives and strategies that were developed by the Treatment and Survivorship Subcommittee. And as you can see, our goal was quite broad. And I want to point out that what we focused on was really the part in the middle. We focused on the need for increased awareness, education, and access. And specifically, we emphasized access for a very diverse population. And if you can go to the next slide, please. Okay. So we had a wonderful group of people to work with on the subcommittee. We had a sort of a combination of cancer centers, patient advocates, and community-based organizations that provide access to a number of very important areas for cancer survivors. And I'm really lucky to be presenting this because my sister died of ovarian cancer just as we were sort of beginning to complete our ideas. And for a while, I couldn't stand the thought of cancer survivorship. And I kind of fled from that world for a while. And then I came back realizing that our definition of what a cancer survivor is really important. So we define a cancer survivor as a person who has cancer from the point of diagnosis through the end of their life. And many of us also include the caregivers and loved ones in that definition. And what I think you'll see as we go through this is because of that definition, our strategies often blur distinctions between treatment and survivorship and cover both areas. So let's start with our first objective. We had absolutely unanimous support for this. We would like to increase enrollment of diverse populations in cancer clinical trials, therapeutic trials, and non-therapeutic trials. And I think two main reasons why we think this is important. One is that there's a lot of evidence now that for us to understand treatments and to improve outcomes for our diverse population, we really need to broaden the diversity of the people we are studying so that the results apply. Also, when frontline treatments no longer work, sometimes clinical trials offer the only treatment option. And we really need to make sure that we are offering access to these treatment options to all patients. So some of our strategies include the education piece. We really need to increase patient and caregiver education about how clinical trials work, how we can, or how patients can evaluate them, and also how to access them. So if you're interested in a clinical trial, how do you actually get into one? Who do you call? How do you get in? How does it work? We also need to educate the clinical trial staff, not just the investigators, but also the auxiliary clinical trial staff, so that they also understand the importance and the benefits of enrolling diverse populations. And I think when they understand this, it makes it easier to overcome some of the barriers like language or childcare that prevent some people from entering into clinical trials. I think also in terms of number one and number two, we want to support the efforts that the National Institutes of Health, the National Cancer Institute, and other organizations that fund clinical trials are currently doing. They are beginning to offer some guidelines on enrollment of diverse populations, and we want to support that. And we also want to collaborate with cancer centers and our community organizations that are currently doing outreach work in the community. So we want to focus on that. We want to help them educate and help them bring people into clinical trials. Next slide, please. So objective number two is to increase the number of patients who receive supportive care during and after treatment, specifically addressing some of the most overlooked issues like sexual health, intimacy, and fear of recurrence. I think we have many people understand that completing treatment and transitioning to survivorship is like jumping off of a cliff for many people. They've been held closely, treated carefully, and then suddenly there's sort of a vacuum and they fall into that. So we advocate for patients to receive a physical and psychosocial assessment as they transition, and that's what number one is about. There is a lot of research going on right now, and there may be multiple different models, but the idea that's important is that each institution, each healthcare program, each healthcare team is offering this kind of assessment. And what needs to follow the assessment is the referral. So it's very important that patients know where they can get help. And that's number two. We need a comprehensive list of resources that patients can have. I think we haven't paid much attention recently to sexual health and intimacy and fear of recurrence. All three of those things are very commonly identified as problems that survivors and people right after treatment and sometimes during treatment experience. For example, with sexual health, there's often changes in body shape. That could be from surgery or from radiation. And those can cause changes in body functioning and also self-image. And that also has it has an impact on the relationships that people have with their spouses or their family or other loved ones. And we don't really deal with this. There's been a little bit more research about this recently. Stanford just last year started a clinic. It's sexual health for women with cancer. And it offers both clinical assessments, but also psychosocial help and counseling, either with the patient alone or with the patient and their partner. I also want to just mention that mental health coverage is very, very important. So we know that fear of recurrence is the number one problem that cancer survivors identify, causes a great deal of anxiety. And we want to be able to offer mental health services to help people with this anxiety. We do have a problem sometimes that insurance doesn't cover this, or it isn't covered after treatment ends. So we want to advocate for better mental health coverage. Next slide, please. Okay, so I actually, we'll go back. So I actually have talked a little bit because we did call out increased clinical trial participation in education. But I want to talk about number 3 here, to encourage communication of the cancer treatment goals. Patients and their families need to know what the treatment is about, and providers need to know what patients want, and whether the goal of the treatment is cure, comfort, or control at any given time. That communication is really important. And it's not just important between the oncologist and the patient, but it also needs to include the caregivers. It also needs to include the patient's primary care provider and any other specialty services like palliative care or mental health care, or patient navigators who are working with the patients to get things done that they want to get done. So we not only want to increase the communication, but to broaden it amongst the team members. And then also, obviously, we want to make sure that community-based organizations, which often provide support in these services, that they also advocate for clinical trials, because I didn't mention that with the previous clinical trials. Again, we really want efforts to be focused on currently underserved populations. Okay, and we'll move on to the next one, please. All right. We want to increase awareness and achievement of exercise guidelines for cancer survivors set by the American College of Sports Medicine. And that is basically 150 minutes per week of moderate intensity aerobic exercise. And I think exercise is something that we're all aware of. We hear about it, we see it a lot. We have a lot of data showing that exercise has many benefits for cancer survivors. It's also one of the most commonly asked questions by cancer survivors. I think that probably exercise and nutrition, how much exercise, how should I do it, what should I eat, how do I remain healthy? These are big questions that cancer survivors have. And so I think we owe it to them to fulfill some of these strategies and really support them in getting the exercise that they need. I actually want to focus on number 3 and 4, because I think they're a little bit less well known. And part of that includes supporting trainers, support the training of exercise trainers with oncology certification. This can be done, and it's very important because there are some programs like through the YMCA or number 4, where you can actually get somebody who's trained with oncology certification. But we need more people to be trained in this so they can provide the services to our patients. And I just mentioned 4, which is a really great place where people can search a registry and find healthcare providers or exercise professionals, where they can find people who are trained in providing specific exercise guidelines and programs for people with cancer. Okay, we'll move on to the next one. So this is by 2025 to decrease the number of patients with cancer who experience financial distress or healthcare costs during and after cancer treatment. And I hope that I'm coming through clearly, because I hear some background noise, but I'm not sure if it's coming from my computer or not. So I think financial toxicity has become a really well-known term that describes the stress that patients and their families feel when they're overwhelmed by the bills that can mount up during cancer treatment and post-treatment. And obviously this is not healthy, and obviously this is not good for people's their healing after their cancer treatment. So one of the things that we would like to promote in number 1 is make sure that successful treatments are moved as quickly as possible from the category of experimental, when insurance companies won't cover them necessarily, to medically necessary so that they will be covered by insurance. Number 2 and 4 involve working with hospitals and healthcare teams so that everybody, including the providers and the patient understand what the cost of their treatment will be, and also have access to any reimbursement programs or special financial aid programs that they're eligible for. Finally, we want to provide ongoing education to financial navigators. Things change all the time and fairly rapidly in terms of coverage and new treatments. And it's very important that financial navigators continue to receive ongoing education so that when patients meet with them, they have the latest news and they're able to steer people in the right direction. And finally, we just want to support that all patients are encouraged to meet with a financial navigator, because unless you know the ins and outs, you can get caught in some of the financial toxicity, and we really want to prevent that as much as possible before it happens. Okay, I think we're going to move on to, yes, this is collaboration, which I consider one of the single most important parts of working with the strategies and the objectives that we've put forward. There's a lot of work to be done, and quite honestly, we can't afford to do it alone. So I think that an example of the collaboration that I've been involved in is the Bay Area Cancer Survivorship Coalition. It's a large group of hospitals and other medical practices and community-based organizations, public health experts, government, politicians, boards of education, as broad a collaboration as you can get, focusing on the awareness and education about cancer survivorship and the resources that people need. We recently hosted a webinar with over 100 people to talk about cancer survivorship and what people should be expecting and how they can get the things that they need. And I think that there's a very strong need for groups like ours, an existing coalition, to collaborate with CDOC's survivorship workgroup. Because again, I think the more people we have working together, the stronger we'll be and the more that we can accomplish. So thanks very much. And I'm happy to answer questions at the end.
Thank you, Allison. And I also want to make a note on this slide here. The Cancer Center recommendations that you see on this slide are actually a part of a brand new chapter that we have in our cancer plan for this iteration, the Cancer Centers, California Cancer Centers chapter. So we actually convened all 8 NCI designated cancer centers in the state, as well as other COC accredited cancer centers in the state, to come together on how we may implement some of the recommendations put forth in this chapter of the cancer plan. So again, these recommendations that you see here are for or are what cancer centers have kind of put out for the state to work on around cancer survivorship. So just wanted to make sure that everyone knew that those were also in this new iteration of the cancer plan. And also to note that we just recently convened this group of around 40 or so cancer centers, and we are still trying to identify a point of collaboration, but just know that survivorship has been brought up, and there are there may be opportunities for our work there. And next, I want to introduce our next speaker, and I'm going to turn it over to Catherine Thompson from Zero Breast Cancer.
Thank you, Shantae, and thank you, Allison, for going over the work that your group has done. Really excited to be working with you and with CDOC. I totally agree that collaborating is the only way for us to really be able to move forward in a meaningful way. So I'm going to talk a little bit about what we've been doing at Zero Breast Cancer and how we have been trying to address some of the goals of the cancer plan under survivorship. So about 25 years ago, there was a group of otherwise healthy women who had been diagnosed with breast cancer, And they gathered around a kitchen table and started a quest to find out why they got the disease and how to protect their daughters, their nieces, and future generations. So I just want to start out by saying that I am in Ohlone territory today. And next slide, please. And with zero breast cancer, we have been working, as you can see here, with not only breast cancer survivors, but also with younger people. Our work is to reduce the burden of breast cancer. And here you can see some of the community members we've collaborated with over the years. With the younger people, we have been working on reducing the risk of breast cancer, creating campaigns for kids, their parents, and people of all ages to promote health and wellness. Today, I'm going to focus on what we've been doing in survivorship. So next slide, please. What we try to do, and what we have been doing from the beginning, is to create a bridge between the experts, the scientists, the researchers who are doing the latest work, and with communities, because it's so important for people who have been affected by diseases to actually have a voice in the research that's being done, make sure the priorities are in line with what the needs are, and also then for the information to get out as quickly as possible to the people who really need that. So what we do at Zero Breast Cancer is we create engaging materials to focus on things that we can do to reduce the risk of breast cancer, both in younger people and of all ages, as well as the risk of recurrence, and to promote quality of life. So next slide, please. One of the things I like to start out with is just explaining what health equity means to us, because this is really one of the primary goals of our work. And health equity is the absence of socially unjust and unfair health disparities. And it's not just the absence of disease, but also it has to do with a physical, psychological, social, economic, and spiritual well-being. So we talk about trying to address the systemic issues in health, as well as the more obvious medical side of things. And it's particularly, we focus on less advantaged groups. So those who have lower income or not English speakers, etc. So next slide, please. This is a slide that was supplied by Dr. Scarlett Lynn Gomez at UCSF when she did a webinar for Zero Breast Cancer last month. And I really like this because it helps to demonstrate how broad health really is and all of the things that go into it. So whether we're talking about cancer patient survivors, or we're talking about, young kids, all of these factors play an important role. And we don't want to just focus on what it is. At Zero Breast Cancer, we really want to focus on the broader issues and not just on individual behaviors, although we do focus on that as well. Next slide, please. Back in about 2013 or so, I had been attending conferences with other people in the field, mostly in breast cancer, but in other cancers as well. And one of the things that we were all discussing was the new idea, back then it was new, of survivorship care plans. And one of the things that we were concerned about is how those could really serve people from communities that do not, for example, have access to the academic healthcare centers, who do not have the literacy levels to be able to understand a lot of the materials that are produced, who don't have the health literacy to understand their diagnosis and all of the different pieces in it. So we applied, and I am very happy to say that Roxana Bautista, who is on the call and is in the very front there on the right-hand side, we got a group together and applied for a PCORI award. And PCORI is the Patient-Centered Outcomes Research Institute. It's a quasi-governmental source of funding that encourages the community to have more voice and patients to have more voice in research. What we started doing back in 2015 then was meeting to talk about what all the different organizations that we represented were working on and what things we had been seeing and where we thought we might be able to make a difference. I really wish I had known about Allison's group at that time, although I guess that group hadn't yet started, but I just feel like this is a really good way for us to understand what is going on beyond the groups that we work directly with. So we decided that it was to first of all call it survivorship care planning, not just a plan, not a single stagnant document. And then we went out and we surveyed people that worked with each of our organizations. So we had surveys in English and Spanish and Chinese, and it was a small sample, obviously just among the people who we worked directly with. So these were people from the greater San Francisco Bay Area and also up in Mendocino. And actually, I think we had one person who had moved to Montana and another was in Pasadena. And one of the things that we decided when we were looking at this is for the communities that had the greatest needs, we thought patient navigation was really an area where we thought more focus should be put. So next slide, please. Just to give you an idea, these are the organizations that were involved. So many of these are direct service providers, like Women's Cancer Resource Center. They have support groups for LGBTQ+, as well as Black women and Spanish-speaking Latinas. And they also have free therapy that they provide to community members. So we really were trying to get the broadest representation possible to really understand what people were facing with breast cancer survivorship. So next slide, please. As you can see here, we actually got a pretty diverse group. There was about equal numbers of Black, Asian, Pacific Islander, American, and Latinas, and a slightly smaller number of whites, and then a couple of people who gave more than one answer. Next slide, please. And the results that we got are going to be too small for you to really read here. So I did put in here a link. We made a short link, cdclink.org/BCSC report, that's the Breast Cancer Survivorship Collaborative report. And I'll just quickly mention that almost half of the respondents reported that memory and thinking problems were one of the issues that they faced, and they didn't feel like they had enough support with. There were also a lot of people, about more than a third, who reported concerns about physical side effects of treatment and mental health effects, and then healthy living and some of the other issues came up as well. Like
3 or 4 years ago. She'd be fucking dead by now.
Somebody's not on mute. So what we did then was to try to take this information and then take it back out to the community. Next slide, please. We not only had those specific answers, but then we also asked people open-ended questions about what things they wanted assistance with, what they felt were the most important needs to be addressed. And so this is a word map, a word cloud that came out of that. Next slide, please. And then we took the results out. We not only reported back to the people who had been involved in the process, which were the patient navigators, who were the people who did the bulk of the interviews, many of which were done verbally because we didn't want people to have to fill out a paper form. So our thanks to the folks who did that really important work with us. The collaborating organizations then have been using this information in making sure that the services they provide are addressing needs. And at Zero Breast Cancer, then we organized a bilingual workshop at the Latino Cancer Summit to provide information. And I really was very happy to work with Yadira Rodriguez and Veronica Penado on that project. And we are continuing to talk amongst this collaborative, or we have been for a couple of years since the funding ended. However, as Allison will tell you, and Shantae can also attest, and Roxana, it's very difficult to keep these projects going when this is not your main job, when you have other things that are clamoring for your attention. So that was one of the reasons why I thought it was so important to try to find other ways to get the information out. Next slide, please. One of the ways that we do our work at Zero Breast Cancer is by, as I said, collaborating with researchers. And we have been involved for the last 15 years with the Kaiser Permanente Northern California Department of Research on the Pathways Breast Cancer Survivorship Study. In Northern California, who had been diagnosed with breast cancer at the time of diagnosis. We have an amazing collaborative with researchers also from the Fred Hutchinson Center up at the University of Washington and Arbor in New York. And the role that Zero Breast Cancer plays then is to provide that bridge that I spoke of earlier to help to engage the community. So this study has been funded by NCI now for about more than 15 years, and we are thankfully going to be funded for another 5 years to be able to continue to follow these women. Some of the things that they've been looking at from the very beginning are whether women with breast cancer should eat a particular diet, what kind of exercise is best, when should you start, are there any dietary supplements or herbal remedies that might be helpful for survivors, and what role do friendships and social networks play in well-being of survivors? And all of those things we know are important, but the specifics of them have been much harder to figure out. So they have been, or I guess I could say we have been collecting data about the women's genetic backgrounds, the tumor characteristics, the lifestyle choices, the neighborhoods in which people live, and also just other information about their lives, and hoping to be able to provide more objective information about how to be healthy in survivorship after a breast cancer diagnosis. So next slide, please. In order to engage the community, back one, there we go. We have been created a community advisory board. Nope, next one, the community advisory board. There we go. So we had recruited 10 people from the cohort of these 4,500 women that were diagnosed, and looked for geographic and age and racial ethnic and other kinds of diversity. And then we have been meeting quarterly since 2016 to get information from these women, as well as 3 other members of the community. So the other 3 members of our CAB, our Community Advisory Board, are a social worker, a cancer social worker, a breast cancer survivor who is younger than our average in the study, and a retired breast surgeon. We have been then talking about the different ideas and priorities that that the members of the cohort have, and these representatives of the cohort have, about what we should be doing research on. They have not only helped to shape the directions of research, including giving some ideas that have been incorporated into the next round of funding, but also helped to ensure that questions about things like sleep are included in the questionnaires that are being done annually. So it's been a wonderful way to make sure that the voices are heard, and we also then report back out to the larger cohort via a newsletter. So that newsletter is one of the ways then that we are trying to translate the findings of the research and other evidence, other latest information about not only breast cancer treatment, but how to be healthy, and to help to improve survivorship, not only reduce the risk of recurrence, but also quality of life, to improve quality of life, not reduce it. So we've been sharing that information with study participants, and now we are working to share it with other breast cancer survivors. And we've also been working to try to reach the caregivers, so the clinical folks. One of the things that we found after we had done the survey was that sexual side effects, as Allison had mentioned, are highlighted in the cancer plan. Well, that was not something that people often feel comfortable raising. And when we talked to breast care coordinators, they said that this is something that people will very privately discuss, but it's one of those issues that was not addressed in our survey directly. So it's been important to get information from multiple sides. Next slide, please. So the next slide shows a photo, here we go, of the wonderful women that I have the honor of working with that are members of the CAB as well as the staff at Kaiser Permanente. So I really want to thank them for all of their work that they have done, and many of them are going to continue on with us into the next 5 years of the study. Next slide, please. So I mentioned that we have been writing articles based on the information that is found in the study, but the topics that we have prioritized were based on the interests and concerns of not only our group in the CAB, in the Community Advisory Board, but also based on that survey. So we are taking the articles that were written for the newsletter for the Pathways study participants, and now we are translating those into a survivorship fact sheet. These are in English and in Spanish, and the memory and thinking problems one will be out probably next week at the latest. It will be on our website. We've also done in English and Spanish articles on pain and neuropathy and self-care, and coming up we're going to be addressing heart health. So the CAB members felt that it was important not only to get this information out to the people who have breast cancer and to the caregivers, because they deal with some of the same issues, but also to try to make sure that clinicians are informed about what these concerns are and how to address it. It is so difficult for people to keep up on everything that is going on in the field, and we've had, of course, turnover within the Kaiser system. So now we have a member of our Community Advisory Board who went to someone who was not familiar with the Pathways study. So we want to do some outreach and make sure these folks know about these resources that we are creating, and to make sure that we get input from them as well. As you can see, there is an email address here at the bottom, where you can email us to order copies of those. We're going to be trying to make hard copies available. As we do with all of our materials, it's always free, although it all depends on our budget. So the other thing that we would like to do, of course, is to translate this into Chinese and to other languages if possible. Again, it depends on the finances. Next slide, please. So that's a summary of what we've been up to most recently on survivorship. We are also doing a webinar series on health equity in breast cancer. And the previous webinars that we did are available through our website on YouTube. And the next one, which will be featuring Ana Napoles, who is a senior science director at the National Institute for Minority Health and Disparities. She was at UCSF, and she was actually involved in our breast cancer survivorship collaborative before she moved on. And we will also have Nikki Fairley, who is the director and founder of Touch BBCA, Black Breast Cancer Alliance. And one other person. Our registration site is not yet live, but it will be in the next week or so. And if you sign up on our website for our email list, then you will receive information about that for the future. In the fall, we're going to be talking about environmental justice for breast cancer prevention. So I believe there's just one more slide, and that is the usual on how to connect with us so that you can find out about our webinar, as well as it has my email address on there. If you have any questions that don't get answered today, please feel free to contact me. All right, so next slide. One of the things that we did feature in the cancer plan were some select resources to help people to address these issues that we've been talking about today. So we wanted to make sure that folks were aware of some of our favorites. A few of these are mentioned in the cancer plan and some are not. One of my favorites is the American Institute for Cancer Research. It's AICR.org. They have a lot of information on nutrition and physical activity, and those are the kinds of things that we promote through Zero Breast Cancer because we like to focus on things that people can change. We do want to focus, though, on the broader issues as well. So that's why we're trying to advance this health equity topic. The National Cancer Institute has some really nice resources for survivors directly, as well as for caregivers and for oncologists. And ASCO, the American Society of Clinical Oncology, their cancer.net is really a great resource also. So I think, Shantae, back to you.
Yes, thank you, Catherine, as well as Allison. Thank you both very much for your presentations. We do have a couple of questions in the chat, but we also want to take this time to let you all know that you can bring yourself off of mute if you do want to answer or to ask a question. So the first question we have, Rob Tufel, who is actually a member of our treatment and survivorship, or a part of our survivorship work group. He says, we have been talking about lack of plans for cancer survivors since the Lost in Transition Plan report came out in 2006 with varying degrees of success in meeting the needs of cancer survivors. Are there strategies that this plan will develop that address the issue in a new way and create standards that can be adopted throughout California? So, you know, I'll let Allison chime in on this, but I want to first say that, you know, the last plan that we had 2016 through 2020, although it wasn't released, the coalition still did follow those objectives and strategies in that plan. And one was focusing on survivorship care plans. So we had a lot of efforts. Those were actually our main efforts of the work group before we started developing the new cancer plan. And we actually developed a guide. The work group developed a guide in collaboration with Triage Cancer on working to have health systems as well as patients give them information on how to get that survivorship care plan. And I know that when we started developing this new plan, because of all of the challenges that, were involved in ensuring patients got these care plans, there was the shift, or the focus kind of shifted, and that importance is there, we still know, but I know that the group decided to focus on these other objectives. So I'll let Allison speak to that, because I do know that that was part of the conversation when we did start to develop the objectives for this.
Sure. Thanks, Shante. So first of all, I just want to say it's a great question, Rob. It brings up a lot of discussion. And I also want to say that Rob he was actually the one that started the Bay Area Cancer Survivorship Coalition back when it was the Silicon Valley Cancer Survivorship Coalition. So I don't want to give too long of an answer, but this is going to be a little bit of a long answer, so I apologize. I think that there was in the past a very large emphasis on a survivorship care plan, and there were a number of different, set survivorship plans. ASCO had one, different hospitals had their own. Clinicians were spending a lot of time preparing cancer survivorship plans. And what came out in research that was published in 2019 is that the survivorship care plan by itself was doing very little, if anything, to actually improve outcomes for cancer survivors. Part of that is because a cancer survivorship care or a survivorship care plan needs to be individualized. It depends on the treatment you've received. It depends on what the patient's goals are, et cetera, et cetera. The second thing is it tended to be a very long document, sometimes 12, 13 pages, that really didn't go anywhere. It got filed or it got left in a pile somewhere. It wasn't getting used. So I think what we've done, my answer to this is, so what is important for cancer survivors? And I think that the treatment summary is very important. So the treatment summary shows us, are there particular conditions that an individual patient may be susceptible to based on the treatment that they received and their current health. So that is important. That's a discussion, that's something that should be documented, and that's a discussion a clinician should have with their patient at the end of treatment. The patient goals are important. What is important to this patient? Is it, are they near to the end of their life and quality of life is the most important thing? Are they, in a position where they have a lot of anxiety and they want constant scans and they need to deal with that anxiety? So it's very, very individualized and depends a great deal, I think, on what individual patients and their families want. But that's important. What they want is important. I think what's been determined and where we really tried to focus with our subcommittee is on programs that support. So we know that, for example, we know how important exercise is. We know how important counseling is when it's needed. We know how important legal issues are and financial issues are to cancer survivors, whether they're dealing with, bills or whether they're dealing with questions about going back to work and what do they need to disclose and what do they not need to disclose. So there are a lot of things, including the things that we mentioned about sexual health and body image and intimacy. Those are services and things that cancer survivors need help with. And what we're seeing is this kind of transition to saying what's important for a cancer survivorship program, for example, is not necessarily the actual plan, although the treatment summary is important and the education about it is important, but helping patients access the services that improves their quality of life. And so those were the things that we really focused on right now. I want to add just two more things. Sorry for being so long, but I think that with a treatment summary or with services that people need, what's also really important is that communication between the oncologist, the patient, and the patient's primary care provider. Because ultimately, a lot of people may end up going back to receiving their lifelong care from their primary care provider, and that person needs to be educated about survivorship so that they can help the patient and understand what the oncologist and the patient have set out to accomplish. So I think those are all pieces of it. And I think we really tried to focus on the kinds of services rather than the document itself. And I hope that gives you something of an answer.
I'd like to chime in as well. With our breast cancer survivorship collaborative, that was one of the issues for us as well, is that survivorship care plans it's very not only labor intensive, but to keep that up to date. And also, excuse me, we found that primary care providers really don't necessarily even see them, much less really know what to do with them. So that we decided was not the best focus for the underserved communities that we wanted to work with. And that's where we felt patient navigation was going to be much more useful. That is also one of the reasons why I am so excited about being involved in this work group, is because I think by collaborating together and finding and creating these educational and outreach materials and making sure that the providers, and I don't just mean oncologists and primary care providers, I mean social workers, nurse navigators, everybody across the continuum is aware of the resources that we have available. So if we can create this list and a central place for people to see what kinds of things are out there, I think that will really help us to better meet the needs of patients.
Ask the follow-up question.
That's also my, I just want to say that's also my plug for folks. If you're not already part of the survivorship work group, please join.
I don't mean to interrupt, but just a follow-up question about that list of resources. Has that process been developed yet on how you guys are going to assemble the resources throughout California that are available, community resources, or is that part of the work group?
That is a very big task for the work group. That is a new thing. Actually, Shantae and Roxana can tell you that they did attempt to do that in the past. The problem is that we cannot maintain a database and we cannot try to house that sort of thing. So we will not attempt to do a repository. But we thought at least we can try to link or find some other way to bring together many of the resources. So this is a definite work in progress. And Allison, Shantae, Roxana, I don't know if you have more to add to that.
Yeah, exactly what you said. It's a lot of work. When Roxana was leading our treatment and survivorship work group, we did have something like that, but it was extremely difficult to keep updated. And, you know, another point we talk about is just the fact that there are so many different organizations and sources of information. Where are patients going to go, and what is the value added in another repository? So we're still trying to work out the kinks, because we know resource sharing is very important, but it's just sort of one of those things like, how do we do this?
Okay, but you all will keep us posted.
Absolutely.
Okay,
yes.
Sounds good. Thank you.
And we have I was just going to say, we have 5 minutes left in the webinar. I want to just go over our last slides and then leave a couple of minutes at the end for any last comments. And I also wanted to actually get Rob's response to you know, the responses that you heard. So we just talked about the work group here. So if you are interested in joining us, please do send an inquiry to cdocshare@gmail.com. Our next webinar for the Cancer Plan series is Health Equity in July. So look out for that registration link through the CDOC listserv. The newsletter that was sent out today did include that link to register. And then we have another webinar coming up at the end of the month related to cancer, to survivorship research. And we have Dr. Miller from USC and Dr. Asher from Cedars-Sinai Cancer, who actually also was a big part of developing the objectives and strategies for this work group. And then if you want to get involved with CDOC as a whole, we also do have other work groups that address different priorities in the cancer plan. We have colorectal cancer, health equity, and there are other efforts that you can inquire with to get involved with us. There's the information there. Our website is still a work in process, so know that that will be updated soon. And as we mentioned before, there is an evaluation link, so please fill that out for us. Thank you all very much. And now I want to, with our last minutes here, want to kind of open it up to see if there are any last comments from our presenters or from any of our attendees. There are none.
Well, I'll go ahead and chime in and just give a shout out to Shantae and Roxana for organizing this, Shantae for keeping CDOC going. We really appreciate your efforts. And to everybody who's on the work group, thank you for all your work. Allison, the group's work that you presented today was great.
And my final thing that I want to say to everybody is simply that I really look forward to working with everyone going forward. I know that we have to do this as a collaboration and every little bit helps. It's pretty amazing to have people from all over the state working together on this. I'm really enthusiastic about that going forward. And thank you very much for listening to what we have to present today.
Well, thank you all again. This webinar was recorded and it will be sent out on the CDOC listserv. Thank you all. Have a great rest of your week.
Thanks. Bye-bye.